Joining me via Skype from California is Dr. Rishi Desai. He's the Chief Medical Officer for the health education platform Osmosis.org. Dr. Desai, once again, thank you for being with us. More than 50,000 new cases in a single day, and it's not just California. What is going on here? Why are we seeing such a surge? How did things get so out of control?
Well, there is one country in the world where things got terrible and then slowly were getting better and then they got terrible again, and that's right here in the U.S. No other country have we seen quite this sort of pattern, and right now we're reigning in terms of number of new cases. I think what's happened is that we're trying very quickly to build an economy on a foundation of people that are diseased or dying, and you can't build an economy with a foundation like that. And so we really need to get our healthcare system in a much more safe place before we start reopening the economy again. It's just not going to work that way, and this is what's happened.
President Trump, the White House claims we're seeing more cases because more people are getting tested. But what about all the people who are actually getting sick and have to go to the hospital?
Yeah, that's exactly right. I mean, it's a very convenient narrative to say that it's just because of more testing that we have more cases. That's just not true. In fact, if you look at hospitalizations and deaths, you know that those are going to be rising as well. And here's the thing that's tricky. I realize that it's confusing when people are sitting at home and hearing this, and it feels alarmist. But there's a delay between having a case, getting hospitalized a couple of weeks later, and then dying a couple of weeks later. So when we see this rise in cases, you know what that tells us is, hey, this is what's coming ahead, is this surge of hospitalizations in 2 weeks and a surge of deaths maybe in a couple of weeks after that. So we should look out for that, and we shouldn't wait and be surprised in a couple weeks when we see the hospitals completely filled up. We should expect that and do the right thing today, which is to shut things down. The state of California is a good example of that. Many counties in California have shut things down, rolled things back, because we know we have to do that. This has gotten way out of hand, and other states where this is not happening are going to see a terrible outcome, like Arizona, Florida, and other places where they're just kind of plowing ahead. It's going to be disastrous.
I remember at some point during the height of this pandemic, the Trump administration, I believe it was President Trump himself, who came out and said, summer heat, the sunshine, it's going to make things better. This virus is going to disappear. Clearly, Dr. Desai, that is not the case.
Yeah, I mean, it all seems like a joke. I mean, this summer heat obviously is here now, and the virus is raging. So that didn't work. We've talked about with respect to Trump, he's talked about bleach and disinfectant, and that's ridiculous and dangerous. So these kind of silly assertions are just not playing out the way that we know that that the science predicts it. The science says very clearly, wear a mask, especially in 48 hours. It's going to be July 4th. We need people to protect their families, not go out and kind of put them at risk, and really not go and gather in large crowds. That's another thing that's been happening nationwide, because people just don't understand the seriousness and gravity of what's going on.
There's clearly a quarantine fatigue in this country. And with the 4th of July holiday around the corner, what is your advice or guidance, Dr. Desai, to people who want to go out and have get-togethers and barbecues?
Yeah, so I would say there are things that you can do that are low risk. Gathering in less than 10 people is low risk. Gathering with people that are not old or have diabetes or heart disease, those folks shouldn't be getting together with others because it's very dangerous. Making sure that it's outdoors, it's short periods of time, people are wearing masks, all those kinds of things help to mitigate risk. But if you want to really be safe, I'll tell you right now, I love my family, I love my parents. I'm not seeing them this weekend because I love them and I want them to get through this weekend and the next 6 months safely. I'm not going to see them until we have a much, much better and lower risk situation. And right now, America is on fire when it comes to COVID-19.
All right, good advice there. Dr. Desai, as always, we appreciate it. Thank you so much.